Good afternoon, everyone. This is Jarvis S. Scott with What's Happening in Birmingham. Today, I have the honor and pleasure of being with Dr. Cree Johnson with Brownstone Total Family Healthcare. Good afternoon, Ms. Johnson.
Thank you so much for having me today.
Thank you for taking time out your day. So, October is Breast Cancer Awareness Month.
Breast Cancer Awareness Month it is.
Okay, so I guess the first question I got to ask you is, what are some signs, what are some things over the years that your patients have been asking you about this, very serious disease?
Disorder, yes. So breast cancer is very, very, very common in the community. A lot of times women come in and say, I found a lump. I found a bump on my breast. And you're like, okay, well, first I need to see it. So let me see it, let me feel it. And then you can't just say, I found a lump on one side and not look at the other side. So I want to look at the one that doesn't have the lump so I can kind of have a comparison, because women can have what's called lumpy, bumpy breast. If you go and you feel like, oh, I got a lump here, but I got a lump on the other side. So that may not be as concerning as if you got this one big old lump on one breast that feels like a smooth rock. You know, like when you was little, you could throw rocks in the water. That's what breast cancer feels like. It's like a smooth rock, hard, it doesn't move in one spot. So if I feel that, we immediately get the women in for ultrasound where they put the jelly on and look at the mass, and then they'll also do a mammogram. Then they'll do biopsy and go on from there. So usually the biggest complaint is a lump, but it also can be discharge from the breast. Oh, I have like milk coming out of my breast or bleeding discharge. None of that is normal. If you having any discharge and you had just had a baby, it's not milk, it could be cancer. So they can take that milk or whatever that the substance from the breast, send it off to the lab and see if that has cancerous cells. The nipple can go in the inside and retract and look different than the other side. If it looked normal one day and now it's not, that can be a sign of breast cancer. So it's not just a lump. Get used to what your normal breasts look like. You got to look at them. You got to feel them to know what's normal for you.
Other than signs, over the years, like before this end, we was talking about lifestyle signs. What are some lifestyle signs?
So lifestyle, things that can increase your risk of breast cancer based on your lifestyle. If you are a smoker, smoking kind of increases the risk of cancer in general. Not just breast cancer, it can increase the risk of bladder cancer, colon cancer, you name it. But if you are a smoker, little smoker, big smoker, smoke is bad for you, and it can increase your risk of having breast cancer. Having a high-fat diet, eating out all the time is not good for you. We want to concentrate on having about 30 grams of fat or less in your diet if you're trying to decrease your risk. If you know that breast cancer already runs in your family, these are some things you can kind of start moderating. Exercise and decreasing the fat in your diet, not smoking, and drinking in moderation. I didn't say no drinking. I said drinking in moderation.
Drinking in moderation. Well, can men actually get breast cancer?
Yes, men actually can. I have a cousin who actually was diagnosed with breast cancer some years ago. It ran in his family. His mom had it, his sister had it, and he ended up getting a lump. And we do the same protocol that we do for women. You get an ultrasound, and then they say, oh, it looks cancerous. You get a biopsy. They remove it. They go through chemo. So, yes, it can happen, especially if you have a strong family history of breast cancer.
Okay. As far as self-examination, how many times a month do you recommend?
I recommend doing it at least once a month. And doing it about the same time every month. I either do it on the first day of your cycle or the last day, so you can kind of get into a habit and saying, I'm going to do it in my shower, just arm up and feel the same way on both sides every single month. So if it's going to be a change, you would be the first one to notice a change. I've had women whose husbands have felt their cancer and like, something's not right here. This breast doesn't feel right. Lo and behold, it was a cancer. Well, because he was so used to what was normal for her that was able to get a very early diagnosis and treatment, and she's doing fine now. So if you're not feeling your breast, because you're only going to be going to the doctor once a year to get your well visit, your pap smear, and now those rules have changed. You don't even have to do that once a year anymore. You can do it every couple of years. So we used to have where you go get your pap smear, you go get your mammogram, you get your breast exam. But the rules change so often, you have to be your biggest advocate. Know your breasts, know what's normal, know what's not normal for you, so that you can be your biggest advocate. So you can say, hey, something's not right. I need to be checked out.
Okay. So how often, I know you said once a year, but if someone has like, I guess signs of running the family, should do it more than once?
So you still get insurance pays for you to have a well visit once a year. So you get your well visit once a year. During that wellness exam, you get your order for the mammogram. The doctor likely to feel your breast. But I'm only feeling it once a year. So I don't have a good understanding unless it's something huge that's sitting out there that this is your normal breast or not normal. So if you have family history, and say for instance your mom was diagnosed at 50, you still get your first mammogram at 40. Like the basic guidelines are. But if your mom got diagnosed when she was 40, you need to get it when you're 30. So you need to know your family history so that you can know when to start getting screened. This year, in the last couple of years, African American women have been given an earlier prevention setup. So now we can get our first mammogram after the age of 35. Usually it was 40 no matter what. So you get one at 35. I had mine when I was 36 last year. I won't get another one until I turn 40. So we're getting baselines because African American women are dying at a faster and higher rate than non-African American women. So we're getting these baselines. So at 40, if something's changing, they've got 4 years to say this has been slow growing over 3, 4, 5 years. So make sure you get your mammograms. If you're 35 years old, a lot of doctors may not know. If doctors not up to date on the evidence, you go in there and ask, hey, I'm 36, I need my mammogram. So be your own advocate.
Is it very important to go get a second opinion sometimes?
Sometimes it is. You can get a second opinion. I always encourage people to get a second opinion. I've had women in their 20s to come in and end up having breast cancer up until 80s. And usually from your primary care doctor or your GYN, you go on to a surgeon or someone else, and they can say, yes, you need to be examined further, or we need more tests. So I think second opinions are always great.
Okay. One thing I read about, can you talk about the importance of stress and how that can affect it?
Stress can cause your immune system to get low. As your immune system is depressed, you get more risk of infections, overstimulation of cells, and that can put you at risk for having cancers as well. You have to just kind of remember that you, as women, we're working, we're wives, we're moms, we're doing everything for everyone else except for ourselves. We have to be our biggest advocate. And as we are our advocates, we can kind of rest and relax and mellow out. That may save you and keep you around a little bit longer for your kids and your grandkids. So make sure that you're not stressing out. And in our stress, forgetting to take care of ourselves.
Okay. Last but not least, you're located here in Birmingham.
Yes, I am.
Tell me your address, location.
Yes, I am located at, my practice is Brownstone Total Family Healthcare. I am at Building 48, Suite 154 at St. Vincent's East Hospital. That's 48 Medical Park East Drive, Suite 154, Birmingham, Alabama, 35235. And our number is 205-202-5650. Let me know if you need anything.
And last but not least, this is a question you didn't think I was going to ask you. Why did you choose a career in medicine?
I chose a career in medicine. My dad is a pastor.
Okay.
And we did a lot of visits, home visits and hospital visits. My mom hated going to the hospital with him, so I had to tag along all the time. So I go along and I would ask all the most inappropriate questions about everything that was going on. Why you got that hanging out? What's that? So it just made me have a love for all these things I knew nothing about. So as the years went on, the hospital became just another comfortable place because we were going. And when I got into school, my dad was like, oh, Miss Smith is in the hospital. I can't get by there to see her. So I could go there and do the visits for him. But I also could learn more about medicine. So from there, I decided to own a career in medicine and did family medicine so I can see everybody, babies to grandmamas, men to women, and everything in between. And it has been such a joy and a great ministry.
Okay. Well, Dr. Johnson, thank you for taking time out your day. Talk about this important subject. Hopefully we can get her back again.
Yes.
And for more interviews, please check out my website, what'shappeningbirmingham.com. Thank you all again and have a great day. Bye-bye.
Bye. Thank you.